I just want to say a huge thank you to the Chamber and to the Boards of Trade for inviting us back again. What's interesting is as I'm standing in the lobby, I realize I'm amongst friends because there's almost nowhere I can look that I don't see partners and collaborators that we all work collectively to build a better Durham community. And so I hope you won't be too bored. I hope you have a cup of coffee so that you can stay awake, because I think in some cases I'm going to be sharing news that you might know, but hopefully I'm going to be sharing some new things that you haven't heard before. Our team is very connected on social media, and they wanted me to make sure that I put this picture up so that you could scan this code if you wanted to follow us on social media. And what I would also say is that I'm also available, through direct messaging or through my email link on our website, because we really do want to hear from you, both the good and the bad, so that we can work collectively together. So with that, I just want to talk about some highlights for Lakeridge Health, and this is what I'm hoping to cover over the next while, to just walk you through where we are, what we're doing, what we have accomplished, and what's on the horizon for all of us at Lakeridge, and then more importantly, how that impacts and grows our community. So this is sort of that guiding light for us at Lakeridge Health in terms of our vision, mission, and values. And this came about through our strategic plan that we're currently involved with, that ends in 25. But our board has endorsed the movement of this carrying for our next strategic plan. And it's about building that one system best health and empowering people to live their best health. And then for us in our organization, how we can demonstrate the values that are really important to care delivery. It's interesting because when this strategic plan was developed and this vision statement, I think people didn't really understand the impact that it was going to have, during the pandemic, and what it meant for partnership. And it's more relevant for us today than I think it was even 4 years ago when it was envisioned. So we're just really happy to carry on this and strengthen it even more. And so you would have seen that video in terms of more than a hospital. This is Lakeridge Health. So we're actually doing a launch of a new campaign for a full year, because surprisingly, when we say, hey, we have 5 hospitals, we have 30 locations, we have this, we have that, people are surprised by the depth and breadth of Lakeridge Health. And it's a resounding theme that we hear across Durham Region and outside Durham Region. So our comms department has come up with a plan to really, over this year, showcase not only our connected and exceptional service, but also to showcase the people that work in our organization, the healthcare professionals, the service providers, and then ultimately how we make the connections for the people we're in service to. So our community, our patients, clients, and residents, and we want to tell that story in terms of what it means to be more than a hospital and to be part of Lakeridge Health. We did a thank you to the VIPs that are in the room with us, and everybody is a VIP, that's what I want to say. And the contributions in our community, small and big, make such impacts. This is one of the biggest announcements we had at Lakeridge Health, and it couldn't have been possible without those partnerships and the support that we receive at every single level, at the municipal, the regional, the provincial level. And I just want to say a huge thank you to everybody in the room. We're in this together, building what we can together. I also want to talk about the partnership and how important these partnerships are and what it means for us. So we're actually supported by 4 foundations throughout Lakeridge Health. And these foundations do an amazing job in terms of fundraising, local connections, collaboration, engagement. And each of them are involved in many key initiatives that are going to help build and shape not only the corners that they represent, but Durham as a whole. I'm also excited to talk about how they've come together to think about collaboration and a unified voice for the entire region in a different way, and that's work that we've just started to embark on with our 4 independent foundations. I also want to talk about our partnerships, and you're going to hear about our partnerships in terms of how important they are for us when it comes to other healthcare organizations and colleges and universities throughout the Durham region. And I just want to apologize in advance to my colleagues and friends at Computech who have been a huge supporter of us. We inadvertently left you off this slide. They've updated it, and we're going to make sure that we get that for all future presentations, because I'm going to talk about how important that partnership is. I would be remiss if I didn't address, one of the big elephants for all of us. We're in a period of growth and inflation in almost every single sector, and healthcare is no different. The other thing is, when we think about what's happening at a provincial and federal level, we know that revenue is going to be tight, and that we need to think more strategically in terms of how we plan for the future. And for us, it doesn't diminish our commitment to that one system best health and understanding everything that we can do for the Durham region. But it means that we need to think about efficiencies, we need to think about new and innovative ways to do things, and we absolutely need to embrace technology. And that's our commitment, not only to our own organization, but the Durham community. We will be unwavering in our commitment to quality, but we recognize that change is needed for all of us, and sustainability is an issue that we need to be thinking about in healthcare. It's hugely expensive in terms of healthcare and healthcare delivery. So what are our priorities when we think about the future? And I won't spend a lot of time on this particular slide because I'm going to walk through each of those priorities. But you can see that we essentially have 5 priorities and pillars that are guiding our work. So the first one is growing and strengthening our teams. And I'm just so proud of this piece. So you'll hear, there's labor shortages, there's problems with recruitment and retention, and healthcare is really under a lot of stress. This is a testament to the teams at Lakeridge Health, to those partnerships with colleges and universities that I talked about. We have seen a 44% reduction in nursing vacancies. So when you're hearing about the problems in recruitment and retention, what I will say is we have a lot of people working really hard, and you heard I'm from Newfoundland, rowing in the same direction, in the same rowboat, to try and figure out how we can solve this problem. So we're investing in students. And so, when I think about nursing students in particular, Durham College, Ontario Tech, we were fortunate enough to have funding for an extern program. So that's nursing students that come into our building before they've graduated. We have hired 90% of those people that come. So what does that mean? It means we have to be such good partners to our colleges and universities, because that's the pipeline of talent for us. And it's the pipeline of talent for you in your business community. And it's going to be an economic driver. When they prosper, we all prosper. And we inadvertently left Computech off that slide. People will talk about long-term care and what it means for personal support workers who work in long-term care. I can tell you we don't have an issue, because we have a partnership with Computech that has a full pipeline to students that come and work in our organization, and then ultimately we hire them. So somebody reached out and said, hey, we want to talk to you about recruitment for personal support workers. And I said, we actually don't have a problem because of the partnership we have with our colleges. And then we focused on some really hard to recruit areas: emergency, critical care, women's and children's, and we're having real success. And again, that's a testimony to our partnership and hard work. So we've done a bunch of other things. We fast-tracked hiring, we've increased our full-time, we've created float pools. We implemented an electronic schedule. If you can imagine, we have almost 9,000 people that work in our organization, and we had people diligently working on Excel spreadsheets, which makes no sense. And so we moved them into this century. We had an electronic schedule, and now we're able to match our staffing schedules to our patient and resident demands. And so what that's meant is we've been able to eliminate agency nursing. For 2 years, we've not had one single agency nurse in our organization. There are very few organizations in Ontario that can say that. And we've also decreased our overtime and our turnover rates way below provincial benchmarks. And all of that is because of partnerships and how we're working. I also want to talk about training the next generation of healthcare professionals. And so you would have heard around our partnership with Queen's University. We started this 3 years ago in the middle of the pandemic. And what I would say is what's interesting is during the pandemic, we broke down every single barrier there was. There was nothing that we couldn't accomplish. Speed was never an issue. I wouldn't wish that back on us, but certainly how we operated within that time period was really interesting in healthcare. And I keep trying to remind myself of that because lots of things are possible when you have a common goal and you work together. So what are we doing here? We now have 60 students in Durham Region that are training to become family doctors. When we're at full capacity, we'll have 120. So you hear the big problems of healthcare access at a primary care level. We have a solution to it. These are people that are spending 6 years throughout Durham Region. If we can encourage them to stay, live, and work, imagine what an economic engine and a driver they would be for our community. And I would say our goal is to make sure every single person who lives in Durham Region is connected with a primary care provider, whether that's a physician or a nurse practitioner. And we're well on our way with this project, and it's because of lots of support. At the regional level, we have Docs for Durham, we have the Ontario Health Team, we have support from the region. Again, it's through that partnership that we've been able to strengthen this program and move forward. The other thing is we've also recognized we need to do more than just family physicians. We've launched a clinical teaching unit, and within that, we're helping support, train, and educate family doctors, but also with our own family physicians and specialists within Lakeridge Health. So we want to think about not only that primary care piece, but we also want to think about those hard to recruit areas that we potentially have for specialty physicians. And this is the first piece of that. So we're just really excited around how we're moving forward with research, academics, and education. I also want to talk about expanding healthcare structures. So we're a rapidly growing community. You've heard about our population expected to double. So we do need to think about the future in terms of the facilities that we're planning for. So just really excited. Hopefully people would know that at the beginning of this month, we actually went to RFP for a new hospital in Bowmanville, the largest announcement for that hospital and for Clarington Region related to healthcare in its entire history. And I know Adrian Foster was here as well as others. We have just had so much support for this. And not only support, we've had financial support, both from the municipality of Clarington and the region of Durham have endorsed us and the foundation that's driving the We Care, We Can campaign, the Bowmanville Hospital Foundation, in terms of the local share, and they're well on their way with that. And we just want to say a huge thank you. This hospital is expected to double in size. And when we talk about growth in Durham Region, this Clarington subsection of Durham is actually one of the fastest growing within the entire Durham Region. And so that RFP will take place over the next year or so. With that, we hope to make the award in early 26 and shovels in the ground in late fall or winter. And I know that right now we actually have crews on the ground. We're doing some demolition around the perimeter, and we're also moving the historic home that's located on that site. So just so excited. And I said to somebody, I think as I was in the lobby, every time we have a piece of equipment on that site, the fundraising is elevated because people see that as progress. But I can tell you this is absolutely happening, and we're so excited by that. And then the other thing that's happening throughout our region is we have planning grants to move forward with post-acute complex continuing care in Pickering and a new hospital to be sited in Whitby. And we're also looking at advanced services within Oshawa and Ajax-Pickering. And finally, to the north, Port Perry, we have plans to create that campus of care where we have primary care, community care, and long-term care all co-located together. So we do have plans about kind of the infrastructure that's needed to support this growing diverse community. So I've talked about, we're on a campaign to better help people understand who we are and the complexity. We have a plan to think about the growth in our region and what the infrastructure needs to look like. But I want to talk about one of the biggest crises that we have throughout our region, throughout Ontario, throughout Canada, when it comes to mental health and addictions. This is a regional priority for us. We have one of the largest footprints for mental health and addictions in all of Ontario. And it's interesting because when I say that to people, I think they're a bit surprised. But let me tell you how we arrived at that place. This is the number of mental health visits we have every year at Lakeridge Health. It's astounding. 5 years ago, we merged with Durham Mental Health Services, which was all community-based mental health throughout the Durham region. And what that gave us was the strength to leverage that whole connection between acute care, primary care, community care, and residential care. Durham Mental Health Services came with that gap that we didn't have at Lakeridge Health. They have more than 30 community-based sites, and they have residential options for people that are in transition from hospital. And I say hospital, not only Lakeridge Health, but Ontario Shores and other hospitals in the province. We actually provide that supportive housing, which I think people are surprised to hear. But it has helped us bring that connection. And so I can't remember if last year I talked about the pride that we had when we merged with this organization. We started down a path to figure out, okay, well, what does it really mean? So you're bigger, you've got more facilities, but tell me on the ground what it means from a care perspective. What does it mean to an individual? Well, this is a complex system, and it means that we can break down as many barriers and that we can make those connections that are sometimes difficult to do. One of the things that this team is really proud of in terms of mental health and addictions is that One Connect, Central Connect, which one number, one phone call connects you to the whole gamut of services that we have to support people. And it has strengthened us as an organization. The other thing I wanted to talk about is our partnership with the Centre for Addictions and Mental Health in Toronto, which is CAMH. And this organization is the largest research and academic institution in Canada associated with mental health and addictions. And through our partnership with them, we're looking at not only how we provide service, but what are the best practices and how can we learn from them to build a better program for the entire Durham community. And that's our goal, that everything we do is going to be based on best practice, research and education. And we want to bring what people have in these institutions to Durham Region. And it's interesting because Sarah Downey, who's the CEO for this organization, who's in the middle of this photo along with her board chair, she says to me, Cindy, today in my emergent department, I have 2 people from Durham. I don't know why they're coming to us when you have that at your doorstep. And I said, because you have a strong reputation and they know what they're going to get when they come to you. And in Lakeridge Health, we need to do better. And that's what started this partnership, a true commitment to do better to the people that we serve. And we're just so excited by this. And I want to do a huge shout out to Dan Carter. He is such a supporter for this work. He has been unwavering in terms of his commitment, his support to us, his support for this cause. And when I share some of the exciting things that are happening, we wouldn't be where we are today without him. And I know he's not here today, but I just want to say a huge thank you. I know Councillor Lee is here, and please extend our appreciation. It really is a partnership that we're so happy to be part of. And so when I say all that, we have a big footprint, we merged with a community partner, we're linking with a research and academic institution. Having said all of that, We know there are people falling through the gaps all the time in this space. And I don't have to tell people in this room, particularly in the downtown core of Oshawa and Ajax, what that means for you in terms of your businesses and your community. Every year I do what I describe as a roadshow. I go to every single council and I give an update on Lakeridge Health. Without fail, last year when I went, every single one of those occasions, people ask me, what are you doing about mental health and addictions? What more needs to be done? How can we help you? This is a regional problem that we need to unite about. And I say a problem, but at the end of this are the most vulnerable, marginalized, racialized people in our community. And it's about doing the best thing that we can to serve people. And so I want to flip that from a problem to finding solutions so that we can build strong communities. And so with that, I want to, I think you've probably heard before, we're advocating for instrumental, innovative changes to our mental health and addictions program. And part of that innovation is based on that CAMH model. It's also based on what we know is best practice. And we have a proposal before government to reimagine emergency and mental health care for the entire Durham region. It's based on a hub and spoke model where you come into a purpose-built space that's safe and we can care for you in a way that quickly does the handoff and transitions of care so we can get police and paramedics back out on the street and we can get the people that are in crisis in front of the care provider. And that's our ambition. I want to again do a shout out to both Mayor Carter, Sean Collier, the Mayor of Ajax. We have a councillor in Whitby who's putting forward motions. Everybody is trying to support this. And the region of Durham has recently endorsed a $2.25 million seed money to help with this in order to get the momentum going. So what I would say is we're on a journey for this. We are not going to stop until we get what we need in this region to deliver what we know is the solution to one of the big problems that we're all facing. And again, this is full partnership. There's so many other people in this room that we're partners with around this space of mental health and addictions, and we want to do this together. There's not enough money in this realm to meet all the needs. So we have to work in partnership so there's no duplication. Because the last thing we need to be doing is competing or duplicating work. We need to make sure that we get people where they need to be so that we can care for them in the best environments. And then the final thing I want to talk about is leading through those partnerships. So you've heard about our partnerships with our community college, with other healthcare providers. I just want to share a couple things with you. So last year we launched Women in Health Symposium. So, when I think about this is Lakeridge Health, and we think about, well, what's the purpose? What do you do? So great, you have all these facilities, but connect the dots for me. Well, the connection is on this one that if you're a woman, and if you're a woman that potentially faces all of the things around cancer, menopause, childbirth, we have that whole gamut. And so in this symposium, we had over 350 people attend. We had women from across the whole spectrum in Durham. We had healthcare providers, all women that spoke about what it meant to be in the system of Lakeridge Health and how we could help not only in terms of screening and diagnosis, but how we could help you navigate the system. I'm really proud of that event. We're actually hosting it for the second time this year. And my comms team said I need to put in a plug that there's still an ability to help sponsor this event if anybody's interested. The other ones that you'll see here are our partnership with Ontario Tech in terms of innovation and technology. So this one is about partnerships that find a path forward when we embrace that technology piece. And what I said before is I think there's way different ways that we can do this within a space that can allow us to get the healthcare providers in front of the people, and that we can do a lot of the things that we do manually by embracing technology. And that's our hope. It's not about replacing people, it's actually about putting them more directly in terms of that care delivery path. The final one I just want to say is, what does it mean to be a good partner? So we don't need to do everything, and nor should we. And sometimes when we go in the room, you know, I recognize we're a big organization, and sometimes it's hard to, you know, to navigate if you're a smaller organization with us, but I would say that's not our intention. We come with nothing other than a purpose to serve people. And this Grandview one is one that I know I'm proud of, our board is proud of. So partnership with them. This is an organization that supports children with physical and cognitive special needs, developmental delays. Through our one of our foundations, Lakeridge Health Foundation, along with the surgical team at Lakeridge Health, we're actually supporting the state-of-the-art surgical center at Grandview Kids. And through the fundraising arm, we're actually going to equip that the same way we would do with this, a really high-tech procedure room. And we're going to have a recovery space the same as what we would have in critical care. We're actually going to bring our team of physicians and staff to that location, and we're going to provide sedated procedures for kids in a space that they feel really safe. They don't come into an adult system where they don't know, and there's all kinds of noise and unknowns, and we're just really proud of what that means for the kids in this community. It avoids a trip, hopefully, to a downtown hospital, and we want to bring care closer to home. And again, so I just want to say there's teams of people here from Lakeridge Health. There are teams from our foundations who work tirelessly. There's a room full of partners. What I hope I've shared with you is not only what we've done, but where we're going. We're an economic driving engine of Durham. And when healthcare prospers, the whole community prospers. What happens is you have healthy families, healthy communities, you attract talent, everybody wants to come and live in Durham and work in Durham, and that partnership is so important to us. So I just want to say thank you again for the opportunity to come share what's happening, and also happy to take any questions.